Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system providing health, care, and education to the greater New Orleans area. We are a health system with 2 academic medical centers. Our AMC status means we have our finger on the pulse of the latest treatments and technologies in medicine, and we're bringing it right to our community. October is Health Literacy Month. I'm your host, Dr. Candace Robinson, Chief Medical Officer at Touro. Today, we're joined by one of our inspirational leaders, Dr. Takeisha Davis, President and CEO of New Orleans East Hospital. Dr. Davis, thank you for joining us today.
Thank you for having me.
First, we would love to hear about your journey from your work with the State Health Department to now leading a hospital within LCMC Health system.
Well, thank you for asking. It has been a journey. I started my healthcare career working on serving communities at the Louisiana Department of Health. And as a physician, we're trained to take care of individuals, to diagnose, treat, and hopefully cure disease. What I learned at the Louisiana Department of Health is not only is it important for us to take care of individuals, but that we all live together in communities. Much like one of our slogans here at LCMC Health, we're all in it together. For public health in the Louisiana Department of Health, it was teaching me as a physician that each individual patient also has lots of other factors, those social determinants of health that impact their health. And as I transition to this leadership role as the Chief Executive Officer at New Orleans East Hospital, was able to bring that mindset of public health into a clinical setting. What it helps to do is focus us at New Orleans East Hospital on not just diagnosing, treating, and curing our individual patients, but taking into account the other factors that impact their health and focusing on how we can empower and educate our patients to impact those factors. We know that we cannot do it alone. Our doctors, our nurses, our lab techs, all well-meaning and expertly trained. We need help from our partners. And so it also forces us to be in partnership with lots of other organizations that are working on things like poverty and education, like United Way in the city of New Orleans. And so it has been a journey that so far has been rewarding. There's a lot of work yet for us to do, but I think we're on the right road.
Great. Building off that, what lessons learned from working in the public health sector have you brought with you to New Orleans East Hospital?
I think the biggest lessons that I've brought with me are around prevention and education. I can remember going through medical school and residency and being laser-like focused, right, on your differential diagnosis and figuring out your list of what possibly it could be that a patient walked into your clinic or your emergency room with, and then using your knowledge and your expertise and resources available to you to determine how should I treat this, right? How best to make my patient better. With public health, what I brought with me along with those skills is that it's a lot more than just determining what that patient has, but we really should be looking upstream to preventing it. So if a patient comes in with high blood pressure, we should also be thinking about what led to this patient being at risk for high blood pressure or diabetes, and how can we ensure that they have the empowerment and education to be able to deal with those disorders. It's tough, as we know, within our 4 walls of our clinical settings, whether that's a hospital or a clinic, to be able to provide patients all of the tools that they need. But it's also our job, right, in ensuring that when they walk out of those 4 walls, that they feel empowered to be able to improve their health outcomes.
October is Health Literacy Month. From your perspective, why is health literacy such an important issue for health systems today?
It's vital. As a health system, LCMC Health has committed itself to focusing on disparities in health and improving health outcomes for all the patients that we treat. In order to do that, we have to ensure that our patients understand our medical jargon, and there's a lot of medical jargon that we are speaking to them at a literacy level that they understand, that we are communicating to patients in their native language. I speak English as my native language, but not all of my patients, right? So we have to make sure we have tools that our patients then feel that they understand not just what the diagnosis is or what the treatment is, but also understand how they can prevent themselves from getting worse, how that they can identify if there are triggers for their particular disorders to get into treatment. And that's all a part of health literacy. The more that we ensure that our patients understand the meaning of the words that we are communicating to them, the importance of the words that we are communicating to them, then they can be more empowered to help to improve their own health outcomes. Again, we can't do it ourselves. I know when I'm a patient, it's real foggy, right? You're scared about what the potential diagnosis is. You have an expert who's talking to you. And if that person is not intentionally talking to you at a level of compassion and understanding that you can then embrace, you walk out and then you don't remember anything.
Yeah.
Right. So that is why health literacy is so important for our health systems to really intentionally focus on.
So how does health literacy, or the lack of it, impact patient outcomes, safety, and even health equity?
It can be detrimental if we don't have appropriate health literacy. I am at a stage in life now where I'm not only taking care of my kids, but also my parents. I'm not always able to go to the doctor's office with my parents. And I see firsthand what happens when they don't have good communication or interactions around health literacy. So they walk out and they call me and I say, well, what happened? Well, I don't know. They said I have kidney disease. This is the most recent. I'm like, well, what do you mean? You have
No idea.
You have kidney disease. I have no idea. Like, did they tell you needed more tests? I don't know. Did they give you new medicines? Well, I don't know. And it leads to a lot of confusion, anxiety, and inability for patients to be able to actually act on the things that we, as their healthcare providers, are hoping to convey to them. So you can have misdiagnosis, inappropriate use or lack thereof of the medications that we prescribe. They can miss appointments or tests because they don't understand that I'm supposed to do something actively to schedule this appointment. And so it really disrupts the ability for a patient to take care of themselves if we are not intentionally focused on how we are communicating. On the flip side, if we are providing appropriate education to patients and giving them tools to be able to contact us if they do have questions, right? So your daughter does ask that question. Well, I'm not sure. Well, let me call or use my patient portal to ask that question to my doctor. Those tools are extremely important for getting the clarity that you need and helping our patients feel safe and cared for.
Why is this so important for the public, especially in historically underserved communities like New Orleans East?
In New Orleans East, the community that I serve, we already have systemic disparities in healthcare that are rooted in geography, in history, and lack of access, and health literacy just compounds that. So for those communities where for many, many centuries, there has not been adequate partnership with their providers and understanding, it is important for us to implore upon our providers the importance of being in partnership with their patient. That means we can't just be patriarchal in saying, this is what you should do. This is how many times you take this medicine. You should eat this many fruits per day, all those things, and not understanding that I don't have access to fruits and vegetables in my neighborhood. Maybe it's a food desert. I don't have access to those medications because there are not pharmacies in my neighborhood, but understanding how we can get them to the tools that they need. And it's extremely important, particularly in these neighborhoods, because there's almost an expectation in neighborhoods like New Orleans East that have been historically forgotten, that they don't deserve the highest quality of care. And they just accept whatever there is that is provided to them. It's why we see over and over patients coming into the emergency department for preventable illnesses or things that we should have been able to predict, right? If you can't get your medication after 8 p.m. In your community, then I should send you home with doses of that medicine to get you to 8 a.m. when that pharmacy reopens. So health literacy and that partnership with our providers in our community in places like New Orleans East, other communities that are marginalized, is even more important for improving the health outcomes of those individuals in the communities on a whole.
Absolutely. What programs or partnerships do New Orleans East Hospital and LCMC Health have to help promote health literacy across the greater New Orleans area?
I think that I'll start with LCMC Health first as our overarching system, that all of our LCMC Health hospitals are committed to providing programming and opportunities for educational empowerment for patients. So whether that be at New Orleans East or West Jefferson Medical Center or Touro or UMC, all of our hospitals have programs where we provide educational empowerment for patients. So we bring patients in for education around diabetes, cancer screening, and so much more. And those programs are important to allowing our community members not only to learn information, but to ask questions, to feel that they are now have an advocate for them in our hospitals, and that we're not there just for their sick care, but their well care. LCMC has taken that to another level in partnering with the City of New Orleans on the Be in the Know program. It is a health literacy program where we are bringing educational materials, sessions, and opportunities across the metropolitan area. So not just in our hospitals, but to libraries and community centers, churches, and partnering to say these are basic skills that we should all be comfortable with. You know, it's scary going into the doctor's office, even as a doctor, right? It's scary going into the doctor's office. And even though you tell people you should ask questions, you should advocate for yourself, sometimes you don't know how to do that. So providing those tools and saying it's okay to say, wait a minute, I don't understand what you said.
I don't understand.
Found what you said. Maybe I can look it up afterwards. That's what the Be in the Know program is. New Orleans East Hospital, we are really intentional about those partnerships. We invite our community members in for those sessions, whether it's about learning about their joint surgery before and after, their diabetes and how to treat it, or how to eat healthier in a city where we're not known for eating healthy. Are going out with our mobile teams and providing health education to seniors or to students. Those are the types of programs that we provide across the continuum in LCMC Health.
Those are great. So what role does technology, like patient portals, apps, or telehealth, play in making health information more accessible?
It's a game changer if it's used properly. Right. It really can be a great equalizer because, as we know, with technology comes another tool for us to be able to research. Hey, you told me I need to get on Bactrim. Let me figure out what that is. And then I can communicate with you saying, well, this, information says that there is a side effect, and I can be in partnership, feel empowered with my provider and talking to you about, well, that though they have to give you all those side effects, but the likelihood is very low. But if it happens, here's what you do. So it provides access for those who historically may not have had access to their providers all the time, right? And so our portal is a perfect example of that, of being able to get your refills on your medications, ask questions, schedule appointments without having to call people and hope they'll be placed on hold. When, we know our patients are very busy, whether that's with school, with work, with family. So it is a great equalizer, but only if you are able to educate people how to use it. I know we all have stories of our patients who are like, hey, we have a MyChart portal. We want you to sign up. You can communicate with me. You can get your prescriptions. But if we don't teach them how to use it, right, we can't assume that everybody knows how to use the portal just because they have a cell phone. I know my dad is like, I use my phone to make phone call, to call people. So show me if there's something else you want me to do on it, you need to show me how to do it. But once you do, right, it provides that access to them. Telehealth also provides access to services to our community members who may be geographically challenged, may not be able to come physically in to an office because they're at work or they don't have the ability to get to those locations. But they can actually then see their doctor, right, through their smartphone. You can have your doctor to do a visit and tell you if everything's okay, or maybe you do need to come in via telehealth. And I have been pleasantly surprised by the number of our patients who utilize the service, not just our young people that we know do everything with a smartphone, but even our more seasoned patients, right, have found telehealth as an option to be able to use, particularly for those visits in between well visits, where they just have questions or maybe something just doesn't quite feel right, or I don't know if I'm taking my medication correctly. You can have a nurse visit or a visit with your doctor there right from your home or from your office. And it really does then expand our ability and our reach. But I can't stress enough how important it is for us to make sure we're teaching our patients how to use that technology so that they can get all of the benefits. No, it's very.
So we mentioned some of the other options that we have for patients, but we also talked about those who may not be able to speak the language. So what other tools do we have?
That's really important because we have a growing population of non-English speaking community members in the metropolitan area. In New Orleans East, we have a large Vietnamese speaking community. We also have a growing Spanish speaking or Latino speaking community. And so it's important for us, not just at New Orleans East, but all of our LCMC Health hospitals to have robust translation services. So in some of our clinics and in some hospital spaces, we have live interpreters, but all of our hospitals have 24/7 devices that we can use to be able to translate in hundreds of languages so that we make sure that we are communicating appropriately to our patients, whether it's in the emergency department or the clinic. In addition, those devices or tablets are not just audio, but they're video, because we also have patients who might be hard of hearing or deaf. So it's important to be able to also provide sign language interpretation for our patients. If we are not able to communicate effectively in the native language of our community members and those who come to us for service, then we know that we are not able to help them in the way that we would like, which is to provide them the ultimate education and care that is possible.
So if you could leave patients and families with one piece of advice about advocating for their own understanding of care, what would it be?
Well, I'll leave them with two. Okay. And I do this with my family because I'm sure you get this all the time too. You're your family's doctor, even if you're not.
Right.
Right.
So
and
true.
so, and trying to explain to them, right, that you need to feel empowered to ask questions.
Yeah.
As a physician, a nurse practitioner, a nurse, we are all happy to answer those questions. That's what we're there for. I want patients to walk away feeling empowered that there are no dumb questions. If we say something that you don't understand, we need to clarify it. You don't actually know what we mean when we tell you that we need you to go and get a colonoscopy. What's that? Right. Make us explain it. Ask questions. That is how you become educated and empowered. Number two, I always say to my family members and to my patients, if you don't feel comfortable with what you have received information, then ask to see somebody else, a second opinion.
Yeah.
A second opinion is your right. And any good doctor, any doctor worth their weight in gold will say, go ahead, because I'm thinking they're just going to tell you what I told you.
Yeah.
If I'm any good, you're just going to get reinforced, right, what I said. I'm not going to be fearful. I want you to be comfortable. If I give you a diagnosis or a treatment plan that just doesn't sit well with you, or you think, maybe my neighbor had this too and they were on another medication. I don't understand why. Maybe I can't use it. Then ask your doctor. Your doctor should say, hey, I have a colleague you can see, right? There's somebody else in LCMC Health. We have 8 hospitals of experts, right? You can see someone else within our system.
So lastly, as we talk about the importance of health and well-being, what do you do outside of work to keep yourself well?
Well, in order to be well, and this is something that we don't do very good at as physicians, we need to follow our doctor's orders, number one. So I've really been trying to make sure that I'm also modeling the behavior.
Practice what you preach.
That's right. Practice what you preach that I share with my patients so that I'm getting my screenings done on time. I'm seeing my doctor at least once a year. I'm getting my annual mammogram. I'm getting my colonoscopy. I'm over 40, probably shouldn't be saying that. But that I'm following all of those screening recommendations, and they're there for a reason, right? They're scientifically based to be able to screen for early detection of any type of cancer or disorder. So I'm doing that much better now than what I have been doing before. And then finding time for those things that pour into me, right? And that may be different for everybody else, and it may change over the course of our lives. When I was my 20s and 30s, I could go work out every day and I could, have some sort of physical activity. Now that I am a little bit older and a little bit busier, trying to do that at least 3 times a week, right? But in the middle of that time, when I don't, I just take some time out for me, whether that is quiet time to read, mindless TV time. It's great to watch mindless TV and not be thinking about work, but having work-life balance. And then last but not least, I do things for fun. Right? So I'm a parade captain for the Mystic Crew of Femme Fatale. I enjoy the time that I spend with my crew members because that, for me, provides that work-life balance and helps me to feel well and complete as a person. And so I recommend to my patients to find those things that pour into you and then do.
Very good. Well, thank you very much for joining us, Dr. Davis. And thank you for listening. Join us as we go beyond extraordinary on the 4th Tuesday of every month.